PowerForms Module 2. Upon admission, a task fires to the task list to complete the intake form. The intake form serves as a good example of a Cerner PowerForm. So let's open the form from our task list and take a closer look. Please note, for training purposes, we will not go through every section within the intake form. Our video will only examine specific sections to cover Cerner functionality. Note there are several icons at the top of the form. The green check is used to sign your documentation when complete. The floppy disk icon will save documentation, but here at Shore Medical Center, we sign rather than save all our documents. A signed document will print with the chart. Saved but unsigned forms will not be included in the printed chart. Should you need to correct or add something to a signed form, you can do so using Form Browser functionality. Form Browser will be covered later in this module. The next icon at the top is the Cancel icon. This is used to cancel charting on the form. Unless you've previously signed a part of the form, clicking the Cancel icon will remove all completed fields in the form. The Calculator icon opens the online clinical calculator screen. To use the calculator, select the formula from the drop-down field and enter the known value. The calculator will provide you with the computed value. Now let's move down to the Performed On field. The date and time displayed defaults in from where the task attached to the form was fired. In this case, the intake form displays the date and time that the admission order was placed. It is very important that you change the date and time in this field to the actual date and time you are interviewing the patient. Forms are made up of various sections displayed in the menu on the left. Clicking on this section will display the fields within each form. Certain sections are grayed out. They will become available for documentation based on answers selected in the previous sections. Notice the red asterisk next to certain sections. The red asterisk designates a section with required fields that must be completed prior to signing the form. Required fields display in yellow until completed. Once all required fields within the section have been completed, the red asterisk next to that section converts to a check mark. Although certain fields have been designated as required for regulatory reasons, it is important to complete all fields within each section to ensure pertinent patient data becomes part of the record. Next, we will look at specific fields within the form. Bold font represents the question. Answers display in the box below. Answers attached to square check boxes are multi-select, meaning more than one answer can be chosen. Answers attached to a circle are single select, meaning only one answer can be chosen. Occasionally, an answer will default in as completed. Next to that field, you will note a sheet of paper with small red arrow icon. This denotes the information completed in the field pulled in from previous documentation. Always review the answers to verify accuracy prior to signing your form. In addition to the fields within each section, you may notice statements displayed in bright blue font. These are intended to provide you with instruction or clarification. Now let's talk about conditional fields. Conditional fields are grayed out but become available for documentation based on the response to the preceding question. For example, if you answer the question related to family member notification as yes, the fields below that question will open, allowing you to document your response. Several sections within the intake form are designed differently than a simple question and answer format. These are referred to as controls and include the home medication list, allergy documentation, and the problems, procedures, and social history screens. As we make our way down the intake form, the first control we encounter is found in the allergy section. When working with a control screen, Always start with existing documentation within the screen and verify the accuracy of the information with the patient. If you find that you need to make a correction on the existing list, you can right-click on the substance and either cancel or modify that substance. Let's click the aspirin allergy. Right-click on aspirin and select Cancel. When the substance screen opens, click OK. Notice a red line will now appear through the canceled substance. The display filter at the top of the screen will display both active and canceled substances when set to all. As you review existing allergies listed, you may find an allergy without a reaction documented. It is very important to include the reaction with the substance listed as an allergy. Right-click on the substance and select Modify. Move the radio button to the reaction, type in the search box to search for the reaction, and select from the list posted. Double-click to add the reaction to the Reaction Symptoms field on the right. Once you verify the accuracy of existing documentation, additional allergy information can be added by clicking on the blue plus sign. Use the search box to search for the allergy. Double-click to add the allergy to the Substance tab on the right. Select the appropriate category from the drop-down. Now move back over to the left screen to add the reaction. The radio button has reset to reaction, so type in the search box to search for the reaction and select from the list posted. Double-click to add the reaction to the Reaction Symptoms field on the right. Click OK to save and close the screen. Please note, reaction type and allergy detail screens are not updated by nursing. Although medications are added through the search screen, food and environmental allergies are found using the Catalog tab. Open the appropriate folder and search for the allergy. Double-click to add, select the category, and then complete the reaction screen. If the patient is unable to provide you with their allergy information upon admission, select Unable to Obtain, found in the catalog under Common Drug Allergies. This response will trigger a reminder at 6-hour intervals to complete allergy information. Now let's talk about the patient with no known allergies. Notice the selections above the substance screen. If a patient has no drug, food, or environmental allergies, click on No Known Allergies. For those patients with environmental or food allergies but no drug allergies, click on No Known Medication Allergies. The final step prior to leaving any of the control screens is to click on the Mark All as Reviewed. This will date timestamp each of the entries to document a completed review. This concludes Module 2.